Okay. Hello, everyone. Thank you once again for joining us. Uh, my name is Dr. Abubakar Isa, and I'll be taking you through a very wonderful topic once again today. Uh, Common poultry diseases, which is an area we felt is necessary to bring to your table. Thank you for joining us this evening. Daniel Zachary from Nasarawa in Kiruka. Good evening to you also. Thank you so much. Adeleke Habib, thank you so much. If you can hear me, kindly let me know. I want you to drop a comment that you can hear me clearly before I proceed. Thank you so much for joining us uh, on this virtual online training this evening. We're going to be discussing something very, very important to our farmers. And okay, thank you so much, Habib. That means I can dive straight into it. Let me share my screen so you can. Okay. I would also like to confirm if you can see my screen. Please, can you see my screen before? Thank you so much. Thank you so much. All right. Thank you so much, Maimuna Sani. So today we'll be discussing how you can understand uh, common poultry diseases. Emphasis on common because there are a lot of poultry diseases, but we're actually going to be focusing on those ones that are very common, that are actually giving most of our farmers lots and lot of problems. And I think you understand the fact that these diseases are part of the problems that, or part of the causes that actually affect your profit margin, because these diseases might actually result in some certain level of mortalities, which would also affect your profit margin. So we're going to be discussing these things so that you can understand how to actually detect them and also know what to actually do as early as possible. One of the most important aspects of our training today is for you to understand, because I do say that any disease that is caught early is actually easier to manage, because if you do not understand what is happening to your birds and then you keep waiting, the birds keep dying. As at the time you actually reach out to us, it might be too late, and then it might be very difficult to manage at that point in time. And like you also know, all our farmers actually have access to free extension service, which means at any point in time they have any challenge, they can actually reach out to us and we'll assist them, because we want them to actually be able to to maximize profit in their poultry business. So, causes of diseases. How do these diseases happen? Because I mean, we've had other trainings in our previous trainings. We've talked about basic principles where you're supposed to disinfect your pen, where you're supposed to prepare your pen, which means if you are disinfecting your pen, you have actually removed the suspected microorganisms in that pen at that point in time. But then 2 weeks, 3 weeks, you start seeing some certain challenges. How do they happen? Sometimes diseases happen due to outbreak. Outbreak simply means when there is a certain disease that is very, very common in a certain area at a certain point in time. At a certain point in time, there could be an outbreak of Newcastle in an area, a certain environment. And then because of that, it might start affecting one farm or the other. So that could result in a disease problem in a certain locality. So when there's a disease outbreak, it could be a reason for you to also be affected by that problem at that particular point in time. And like we also do understand that there are some certain factors that are also predispose birds to some certain problems. For example, let me give you a very simple example about that. During raining season, we all know that most times it becomes like a predisposing factor for coccidiosis. So most times at that point in time, we usually have outbreaks of diseases like that because of one factor or the other. Another thing also is stress. Stress could also be part of a predisposing factor to the cause of disease. Before I proceed, I want you to listen carefully, and I would also like you to get a pen and paper, because not everything I will say might be on the slide that you're seeing. So you might want to jot down some things to be able to go through later, so you can understand some of these things we're going to be discussing much better. So, like I said, stress. And there are so many stress factors. There are so many things that could cause stress to the birds. The environmental factors, the human factors is also there. Environmental factors, if the environmental conditions are not suitable, it could be cold, it could be excessive heat, it could be excessive cold, and that could actually affect the immune system of your birds. And then before you know it, it's just like opening the door for the diseases to actually come in. So it makes it easy for the birds to actually fall sick at that point in time if you have stressed the birds too much. Other factor is also, like I told you, human factor also. Sometimes that is why we always advise you that if you want to carry out some certain activities, make sure you carry out that activity at the cooler part of the day, so that you don't actually stress out the birds too much. If you want to remove your litter, if you want to actually sort your birds and some other operational activities that you carry out in your farm every day. So sometimes, very, very common, this one is very, very critical, and I would like you to listen. Some of our farmers could be very negligent to some of the things that they are actually supposed to do. And most times, this comes around one very topic that, if you know me very well, you know that I like talking about it all the time. uh, Biosecurity, biosecurity, biosecurity. Most times, farmers could be careless, farmers could be nonchalant, farmers could be negligent in some areas that they're actually supposed to focus on to actually protect their best from diseases that could affect them. So most times you would discover that there are some certain little practices, one that surrounds hygiene and sanitation. You see farmers do not wash their drinkers properly, they don't clean their pen, they don't actually clean the environment. I've seen a pen close to a dustbin. I mean, public dustbin where almost everywhere in the area dump their waste. And you can see how that could actually affect the birds. That is like the breeding side. That is like an area where microorganisms are doing party every day. So which means if you have that kind of situation close to your pen or close to your cage, that could easily you can easily transmit diseases to your birds at that point in time. So it is very important to know that you have to actually look out for these things. You have to inculcate best practices around hygiene and sanitation so that you can reduce what we call infection pressure. Now, there's what we call infection pressure. Infection pressure is if it happens that your birds are piling up lots and lots of microorganisms in their system. And because of that, it means their system is fighting so many wars at the same time, which means they are fighting war against bacteria, they are fighting war against parasites, they are fighting war against a virus, they are fighting war. Maybe the bacteria could be two or three at the same time. So if the immune system is overwhelmed, which means it is too busy, it is always fighting one problem or the other at a certain point in time, you are actually giving your birds what we call if the infection pressure is too high, which means, oh, they have coccidiosis, but it might not be showing symptoms at that time because their immune system is fighting it. Oh, they have salmonellosis. It might not be showing because the immune system is also fighting that one. Oh, they might have infectious coryza. It's not showing, or it might also be showing, maybe it is asymptomatic at that time. So it means there are a lot of challenges within the system of your birds, and this happens when you have a very, very poor biosecurity system, which means if any disease problem or any disease organism comes around, they have easy access to your birds. So because of that, if salmonellosis come, salmonella bacteria, if it comes, it enters. If the causative organism for infectious coryza comes, it enters. If coccidia comes, it enters. So it means your system is very, very open. So because you're not maintaining very good biosecurity protocol, you don't have very good sanitation and hygiene principles. So because of that, you are stressing your birds with this infection pressure, and it makes it easier for them to actually calm down with any of these problems, or even the one that is even worse than that at that point in time. So it is very important to actually make sure that you maintain low infection pressure, which means if you maintain good hygiene, you ensure that your birds are actually doing very well, and then they don't actually come down with one problem or the other at a certain point in time. Another area also is to be very cautious about managing one problem or the other, because I've also seen situations whereby you see a farmer, after treating coccidiosis, 1 week later, another problem will land, maybe CRD. After treating CRD, salmonellosis will land. After treating salmonellosis, Newcastle will land. Simply because this farmer has, like I said, very poor biosecurity system, and then it means at maybe the 5 or 6 weeks that you are raising your broiler birds, you are always giving them drugs. You are always giving them treating one problem or the other. I have one of our farmer who told me, she said, because I was following up with her birds, actually, the last batch that she's raising. She said, Doctor, this thing is like magic. Every time I used to use drugs, I'm always using drugs. But this one that you are teaching me, I'm not actually using drugs all the time. Is it magic? I said it's not magic. I've only taught you how to improve your biosecurity measures, which means your birds are not falling sick like before, which means you don't have to use more and more drugs like you used to before. That will save you costs because if you're treating one problem or the other, you are also spending money on buying drugs at all times. Also, you might be losing one bed or the other, and then before you know, you that started with 50 beds at the end of the circle, you only have 35 or you have only 30 left, and that will actually affect your profit margin. So next, disease classification. So most of the common diseases that affect poultry, that affect chickens, is classified into three. We have the viral diseases, we have the bacterial diseases, we also have the parasitic diseases. And we're going to be picking the ones that are common under this subsection. So first we'll look at the viral diseases, and we have two very, very serious problems under this section, under this grouping. We have Gumboro, which we also know as infectious bursar disease. This is a disease that we actually vaccinate using Gumboro vaccine for. I would also like to remind us that it is very, very important to actually vaccinate our birds at all times. So Gumboro disease is a viral disease, and it is also a very, very serious problem. First of all, before I tell you about Gumboro, let me tell you this. Viral problems are always very difficult to manage. That's one. Most times they do not have a cure. Most times they also continue to release that virus in the feces of the chickens or other fluid that come out of their body. So even if you're able to manage it, most times you discover that the birds become carrier of that problem. And then when they are carrier, it means they will continue to pass down that virus till the time that you're actually done with that batch. So at any point in time you have any viral challenge, it is very, very important to note that one, make sure you dispose of your litters properly. Dispose it off far from your environment so that you don't have a reoccurrence of that problem. That is one. Number two, after that cycle, also make sure that you wash all your equipment and tools that you use, your feeders, your drinkers, you wipe your thermometers, you wipe your weighing scale, you wash all your feeders, you wash the entire pen. And then the disinfection pattern at that time is also supposed to be different. You're supposed to actually get a very strong disinfectant to disinfect your pen at that time. Let me give you an example. The Gumboro virus, the virus that causes Gumboro disease, is actually very, very powerful. It is resistant to some of these disinfectant that we use that are not very powerful. So you have to use a very powerful disinfectant to be able to wipe it off your environment. So for you to be able to do that, you have to actually use a very powerful disinfectant. An example of that is formaldehyde. We know formaldehyde, the one we call formalin. It is very powerful. We have it in different percentages. So you can also use some other disinfectant that are very good as well. We have Morigard Lysol is also a very good disinfectant. We have so many of them out there that are also very good. So when you have a challenge like that, you have to actually use a very powerful disinfectant to be able to wipe out that virus. Like I told you, Gumboro virus is very resistant to some of these uh, disinfectants that we use. So, what are the symptoms? What are the things? How do you detect this problem when it happens? Now, Gumboro, the best way to prevent Gumboro is by vaccination. Like I told you, because it is a viral disease, it does not have a permanent cure. It can only be managed. So it is very important to be very careful. And this disease has between 80 to 100% mortality rate, which means when it happens, it can actually kill between 80% of your flock, or the entire flock entirely can be wiped out. It is also an acute and highly contagious disease. What do I mean by acute? Acute means it happens almost immediately, and then it is highly contagious. It means it can spread very fast and easily within the flock. So if you have different flocks, probably you have a batch of birds that are 3 weeks old, and you're having a challenge of this viral problem, and you have another batch that are 1 week old, you have to be very, very cautious. You have to protect the other ones as much as possible so that you reduce the spread of this problem. Some of the symptoms that you are going to notice, first of all, before I say this, it is very important to note majority of poultry diseases have similar symptoms. And some of those similar symptoms that you see is depression. You see them moving to one corner and acting as if they are sleeping. You see them closing their eyes. You see them separating themselves. You will also see that there's loss of appetite, which means there's reduction in feeding, which is also a common symptom that you see in most of poultry diseases. You would also see that their drinking water might also reduce at that point in time. You would also see that some of these problems also come with ruffled feather and also changes in their behavior. You see that they are not very active. You see that they are very a bit somnolent and quiet. So those are the common symptoms. But what separates this from that is part of the things that we're going to be discussing today. So for Gumboro, one of the key things you will notice is the fact that you will see white pasty diarrhea, which means they will be passing white stool. And to differentiate it also, you would notice that this diarrhea comes with a lot of whitish material that will be sticking towards their vent, towards their backside, which means the diarrhea flows down and it stains their backside. And you see whitish material, we call it urate. You see it staining their backside. And also, another thing that differentiates it is you're going to actually see high mortality accompanying coming together at the same time with this whitish diarrhea. Another thing also is you should also note that Gumboro has a very quick incubation period, which means the period that the infection enters their body and the period that the disease will start happening is just between 2 to 3 days. So within a short period of time, if you see these symptoms, the whitish diarrhea and high mortality, you could say that you're actually dealing with Gumboro. Another one is also you are going to see ruffled feathers. Ruffled feathers, especially around the neck and the head. When you see that, you can also be suspecting Gumboro at that point in time. So, like I told you, the common symptoms will also show, like depression. You see them. You see reduced activity. You see reduced feed intake. You see reduced water intake. You see reduced activities as well. So if you see these symptoms, how do you differentiate? Like I told you, you're going to actually see that pasty whitish diarrhea. You're also going to see the company coming together with happening at the same time with high mortality. Now, like I told you, the best way to prevent this is actually through vaccination. Now, how do you manage this? Which means uh, like I told you, our farmers actually have access to extension service, which means when you have challenges, you can actually reach out to us at all times, and we're going to respond to you and help you solve some of these problems. So, part of the reason why we're having this discussion is when you see these things, it is better to report early. Do not waste time. Do not say, "Oh, I want to be the doctor of my chickens. I want to solve the problem by myself." Now, the effect of that is that time you are wasting trying to do trial and error. You could lose 50 bets, you could lose 70 bets, and that is a whole lot of money. I hope we all understand that. So when you see these symptoms, like I told you, Gumboro is very acute, which means it happens very fast. The incubation period is between 2 to 3 days. So within 3 days, you could lose a whole lot of birds. So it is important that when you discover some of these symptoms, you can reach out to us directly or through your cluster leaders to be able to get this help. And we also encourage that you post some of these problems on our WhatsApp platforms for those clusters so that other people will also benefit, would see what problem you are facing and how you are helped and the advice and recommendations you actually got to be able to solve that problem. So we also encourage sometimes we always encourage that our cluster members actually post these challenges on their WhatsApp groups. If your cluster doesn't have a WhatsApp group, please kindly reach out to your cluster leader so that they can open your WhatsApp group and you can join our community so that you can be able to actually easily have access to some of these things. Now, how do you manage this? First things, like I told you, report to us so that we can actually help you. Second thing is we usually give prophylactic antibiotic treatment. This helps in reducing what I mentioned earlier, infection pressure, which means if this viral problem is happening, like Gumboro as we're discussing, if there are other problems, probably another bacterial problem, it will make it difficult. It will make the disease condition worse because the immune system will find it very difficult to be able to actually fight this problem. So you're using an antibiotic at this time to be able to reduce other bacterial infections that might be ongoing at that time, so that it will give the immune system the opportunity to actually help in tackling this problem. And also, there are other methods we actually use. So when you reach out to us, we can be able to actually, based on the condition, based on the current situation, because these diseases present themselves in different methods, because there are different serotypes, there are different uh, 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 these viruses have different virulence level, which means their activity, their how tough they are, how much they hit these chickens come in different ways and different methods. So when we observe, when we see how it is happening, we can be able to actually design a treatment plan for you to be able to be able to get proper result from this problem. Now that is for Gumboro. I'll be moving to Newcastle. Newcastle disease is also a viral problem, a very serious viral problem as well. Just like Gumboro, also, if you have any challenge with this, the virus stays active even if the birds recover. They continue to pass this virus because it does not have a permanent cure. You can only manage it. And the best way to prevent Newcastle disease is through vaccination. If you vaccinate your birds, you can be rest assured that you have given them immunity against this problem. So it is very important that you vaccinate your birds at all times. Before I continue, I would like to remind you that you can follow us on all our social media platforms and also subscribe to our YouTube channel uh, uh, if you haven't done that. So, like I said, Newcastle is also a viral problem, also very a serious problem, has also up to 80% mortality rate, which means when it happens, you can lose about 80% of your flock, which means if you have 100 birds, 80 of them can die, or even the entire 100 can die, which we don't want that to happen. So, symptoms of Newcastle, like I also told you, chicken diseases have similar, they are general symptoms, like I mentioned: the lack of activity, the reduction in feeding, the reduction in drinking of water, the depression, you see them sleeping and all, you see them separating themselves, which is also part of the symptoms that you see with Newcastle. But what differentiates Newcastle? How do you detect? How do you see? Most times, like I mentioned also, some of these diseases present themselves in different ways, in different methods. For Newcastle, for example, we have sometimes it might come with respiratory problems, which means they might be having respiratory challenges. They might be sneezing, they might be coughing, they might be giving some whistling sound because the airways are blocked. Sometimes it might also come with what we call neurotropic signs, which means the neural system will be affected, and this comes with most times paralysis and incoordination, which means they'll be acting as if the bird is mad or crazy. So it will be shaking itself. And that also comes with another sign we call torticollis. As you can see in this image here, the head will turn, the head will be twisting. We call it torticollis. It's also one of the very, very clear sign of Newcastle. When you see that, you know most of the time that you're dealing with Newcastle disease. So, like I said, sometimes it presents itself with respiratory problems. Sometimes it presents itself with paralysis, which is the neurotropic sign, which affect the neural system. And then, but commonly, you see that at the terminal stage, birds will start showing these symptoms of torticollis. Their head will be twisting. Very, very common sign also that happens, which farmers should also take note of, is that you see that their faces will turn greenish. Also, is one of the typical signs of Newcastle. Newcastle also present with digestive challenges. Also, it causes hemorrhages along the digestive line from the beak down to actually the vent becomes hemorrhagic. When you open up the breast, you see those hemorrhages along the intestinal tract. So you also see, like I said, the greenish feces is also an indication of Newcastle as well. So when you see torticollis, you see greenish feces, you see probably respiratory challenge or the paralysis, one or two of these symptoms coming together, and then it comes also with high mortality rate as well, you would be able to pinpoint and say, oh, I'm actually dealing with or suspecting Newcastle disease at this time. And it's very important that you actually report these challenges to us very fast so that we can be able to assist and also give you uh, result oriented solutions so that you can be able to reduce the problem. So those are the symptoms. Like I said, the general symptoms: depression, reduction in feeding, reduction in water intake. Then the clear symptoms, like I said, the torticollis, which is the turning of the neck, the greenish feces. Sometimes it also comes with respiratory problem, sneezing, coughing. Sometimes it also comes with paralysis as well. So at a point in time, you might see Newcastle happening with greenish feces and it torticollis. Sometimes it might be paralysis with the greenish feces, depending on the strain. Because Newcastle has several strains, and then the virulence of these strains. What do I mean by virulence? How severe these strains act on these chickens differs also. So sometimes somebody might have Newcastle, and it might be the less virulent strain. So they might just come with a little respiratory problems. The mortality rate might not be as high as you might see. That doesn't mean it's not Newcastle. It's still Newcastle. You might also see Newcastle that is very virulent, that within a few days you see that the mortality rate is very high. You see this torticollis, you see paralysis, you see the greenish feces happening at the same time. That could also be Newcastle because it is a multisystemic problem. It affects several organs at the same time. It affects the digestive tract, it affects the neural system, it affects the respiratory system. It might be affecting all at the same time, it might be affecting some at the same time. But like I said, there are ways you can catch it from the symptoms that I mentioned: the greenish faces, the torticollis, the paralysis, the respiratory problems, and also the general symptoms of poultry diseases, like I told you, the reduction in feed, water intake, and also lack of activity. So, how do you manage this problem? I would also like to remind you that vaccination is the only way, is one of the best ways to actually prevent this uh, problem, this Newcastle, and that is the reason why we give Lasota. And if you're raising broiler, you know you're supposed to give the first dose and the second dose of Lasota. I have come to realize that most of our farmers don't give the second dose because the second dose is at the fourth week. So they feel like, oh, my birds are already big, so there can't be any problem at this point in time. So I will just leave them. Please don't do that. It's very important that you give all the doses of vaccinations that you're supposed to give at the right time. So most farmers skip the second dose, which is not the right thing to do. Please, let's try to ensure that we actually give uh, the two doses of Lasota that we're supposed to give to protect our birds from this problem. So how do you manage this? Like I told you, viral problems do not have a permanent cure. The only way we manage it is we give a prophylactic antibiotic, and also we have, based on the situation that we are having at hand, that when you report to us after taking history and checking the birds, if we understand the kind of strain or the kind of situation you are facing, we can be able to give you other treatment protocols as well based on the condition that we're actually managing at that point in time. So, like I told you, also, it is encouraging that when you see any of these problems, you report to us early so we can be able to manage this situation in the best way as well. Please, I need response in the comment section if you can hear me, if you're following, if you are actually understanding one or two things. Please say hello in the comment section so that I will know that everyone can hear me and they are following through this training. Also, you can write down your questions before the end of this training so that I'll go through them and I'll be able to respond to them uh, when we're done with this training. Now, next is bacterial diseases in poultry. Okay, thank you. Okay, so bacterial diseases are diseases that are caused by bacterial organism, and the ones that we're actually picking today, we're going to be focusing on salmonellosis and chronic respiratory problems, because these two happen to be the common ones that are actually happening. Thank you so much, Madam Stella. Thank you so much for that. So, salmonellosis is actually a bacterial infection that affect chickens, and it is divided into two. We have pullorum that mostly affect chicks. Chicks, when I say chicks, I mean from day old. Sometimes when you receive your chicks, you discover that you start having high mortality due to this problem. We call it pullorum, and most times this is a hatchery problem, because if the breeders that lay the eggs that they hatch these chicks are actually having this problem, in adult birds we call it fowl typhoid, but in small chicks we call it pullorum. So if the breeders that lay the eggs that they use to hatch these chicks are actually having this problem, they can transfer it to the chicks. And when you buy these chicks, you will discover that they will come with this problem, and it is very, very difficult sometimes to manage. And that is why we always advise that you buy your chicks from reliable sources, from a reliable hatchery, so that you can be able to avoid some of these challenges. So in chicks, most times you see that it's an acute problem. Immediately your chicks arrive, you start having challenges with them. You start having increased mortality. You start wondering what is happening. But I have done everything right. I have done the brooding right. I have given them feed. They said I should give glucose first. I have done that. And then you still continue to experience this mortality as well. So it is an acute problem. It happens almost immediately once your birds arrive. Okay, thank you so much. I can see the comment section. In the comment section, people are responding. So most times when your chicks arrive, one of the common symptoms is you discover that they are having what we call pasted vent, which means their vent from their back, you see that they are having dry feces. When they pass out the feces, it is very thick in nature because of the high urate that is inside, so it doesn't actually drop, so it sticks to their bum and then it dries up there. And then one of the problem of that is that when it dries up there, they will not be able to have passage to actually defecate or to pass feces again. So they will continue to pile up these feces inside their digestive tract, and it becomes an issue. So when you see that, which is one of the common symptoms, you see that they are having pasted vents, you see that they are having this thick dry feces on their bum, and then that actually stays there. And then another thing you also discover, you see that they are you see this lack of activity, you see that the chicks are not active, you see that the chicks are actually also, most times you'll be seeing some of them are depressed, they are not active, they are not eating well. There's you'll be worried. Most times you see farmers will call and say, doctor, these birds are not eating well. They're supposed to have finished one bag, but they have only eaten half of the bag or a quarter of the bag. Then when you ask for that, you start seeing that some of these symptoms are coming out, and then that is also a very serious problem for chicks, because if you don't manage it well, the effect is that your birds will not grow well. So most times you see 2 weeks old birds as if they are day old or 1 week, because they are not feeding well, because this problem is salmonellosis is actually affecting them. And like I told you, in small chicks we call it pullorum, and that most times comes from the hatchery. So that is why it is important you buy your birds from a reliable source, so that you can avoid this problem. And common symptoms, like I told you, that dry feces on their bum, you see that it is, we call it pasted vent. You see that when they pass out feces, it dries on their bum, and then it stops them from passing their feces comfortably. Another symptoms you see, reduction in feed intake, reduction in water intake, depression, and also lack of activity is some of the common symptoms that you see. Now, how do you manage this problem? When it happens, Very, very important. The first thing you should do is to get warm water. When you get warm water, if you have povidone iodine, you drop maybe 1 or 2 drops inside this warm water. Then you get uh, maybe a small clean cloth. Then you pick these chicks one by one. I know it might be stressful, but that is the only way you can increase the survivability of these chicks. That is the only way you can also reduce this mortality. It's part of the ways you can actually also reduce the mortality rate. So you have to pick these chicks one by one, put this cloth inside this warm water that has this povidone iodine. Iodine is, if you know polydine, if you know soke, those are type of disinfectant that contains this iodine that I'm talking about. Just few drops inside this warm water. Then when you dip this cloth inside this warm water, when you bring it out, you squeeze the water out, and then you damp this dried feces. You damp it so that you soften it a little, because if you forcefully remove it, you might injure them, and then that might become another problem entirely. So you damp and soften this dried feces, because most times this feces is dried on their bum. So when you soften it, then you can now remove it, because once it's soft, it can fall off on its own, or you assist them in removing it. When you remove that, you can press their tummy a little, so that the gathered feces that has not been able to come out will be able to come out. And I can assure you that that chick will pray for you at that point in time, because it will have this natural relief. It will feel relieved, it will feel better. And then you continue like that, cheek by cheek. You have to take it one by one. Every cheek that you see with this pasted vent, you have to actually assist them in that manner. So that is one of the ways you can actually manage this problem. Because if you leave them like that, that could be one of the things that will kill them. So you have to actually assist in removing this pasty dried feces that is on their bone. Now, after removing that, it is also important. Every bacterial infection most of the bacterial infection can be managed with an antibiotic. So you get a very good antibiotic. An example could be fluorocol, gentamicin is also good for this problem. Doxycycline also a very good antibiotic of good quality, because sometimes I notice our farmers, when they have problems like this, they prefer to look for antibiotics that are very cheap, and then when they use it, they do not get the required results. So when you have problems like this, uh, please try as much as possible to get a very good drug, and also buy it from a reliable drug vendor. So you give them antibiotic treatment for 5 days. This will also reduce the pressure, the bacterial pressure, and then also can help you to treat this problem appropriately. You can also combine this with a multivitamin, which will also help them in boosting their immune system to help in fighting this problem. Also, in adult birds, part of the symptoms you see is whitish diarrhea. But what differentiates it with gumboro, like I mentioned, you see that this does not come with high mortality. So you see that in adult birds, big birds, you see that they are passing whitish diarrhea at a certain point in time. You also see reduction in feeding. You also see reduction in water intake. You also see depression as well. Sometimes it also comes with ruffled feather as well. So you can also treat that with an antibiotic treatment, and definitely you're going to see a very good result. And like I also mentioned earlier, don't hesitate to reach out to us, and also post some of these challenges on your social media platforms, your WhatsApp groups, your cluster WhatsApp groups, so that we can be able to respond to them, and other people also benefit. Next is chronic respiratory disease. This is also one of the common problems, one of the common challenges that we face as farmers. And most times I've had several complaints, most times. For my Hausa brothers and sisters, they used to say Kajina Snamura, Kajina Snamura. Most times we've had these challenges that farmers always complain. So symptoms are common symptoms of this problem. You see coughing, you see sneezing, you see rails. These rails means they will be making this sound that is abnormal. You also see lack of activity. The common symptoms, like I also mentioned, the reduction in feeding, the reduction in water intake, and also reduced activity. Most times, this comes very clearly with reduction in feeding, especially when it is serious. And sometimes you might also see that. Okay, you must also see that their head might be swollen, which we call sinusitis. You see that their sinuses might also be swollen, like I mentioned. So they might also be passing mucus from their nostrils. You can also see that as well. So those are part of the signs that you see for this problem. It is also a bacterial infection caused by mycoplasma. And how do you manage this problem? First things first, like I also always do tell our farmers that the beginning is very critical. Most times, we used to advise that do not use anything dusty for your birds. Do not use anything dusty for your birds because this is one of the predisposing factors. This is one of the things that causes this problem. You see, some people will actually use uh, sawdust that is actually very dusty from the early stage without covering it with anything. And then when these birds are actually having their activities on this sawdust, it raises a lot of dust. And then once they are sniffing it, this can result in this some of these respiratory challenges. Another thing is also is that this problem can also come from the hatchery sometimes. If birds are actually having if the hatchery is having mycoplasma outbreak, they can also come with this mycoplasmosis because it can also be transferred from the breeders to the chicks. So sometimes your chicks will arrive, and after a couple of days, you discover that they are having respiratory problems already, even though you have taken all the necessary precautions that you're supposed to take. So this problem could also come from the hatchery as well. And also sometimes environmental factors. If your biosecurity is also poor, this problem could also occur. You can actually transmit it from uh, uh, the environment as well. So how do you manage this? Most times I do tell farmers respiratory problems, they always say that they are difficult to manage. But what makes it difficult to manage is because when you are treating, which means you're supposed to treat with an antibiotic. Most times we use tylosin base because the tylosin based drugs has high affinity for the respiratory system, so they are very good for respiratory problems. You can also use enrofloxacin, also is also good for respiratory problems as well. So, but most times when farmers are treating this problem, there are some other things that you're supposed to do. Let me give you an example. In human beings, when you are having kata, when you are having mura, if you're always drinking cold water, if you're always staying under the fan, if you're always going through, passing through a dusty environment, you've discovered that even if you're taking drugs, it will be very difficult for this kata to go, except you start taking those precautions. That is what would actually help in solving that problem for you quickly. The same thing applies here. If you are treating this problem, meanwhile, your birds are in a very dusty environment. It will be very difficult for this problem to go easily. If you're also managing this problem, it happens that they are not having very appropriate ventilation, and probably you don't pack your litters at the right time. So uh, maybe ammonia is gathering, and they keep sniffing it, and it keep hurting their respiratory tract. That could also exacerbate and make this problem worse. So when you are managing this problem, ensure that there's adequate ventilation for your bed so that they don't you don't keep them in a room or a space that lacks ventilation. That's one. Number two, also ensure that you avoid any form of dusty material, maybe your bedding or maybe the environment, because that can also make it worse. Even though you are treating them with the right drug, it's the time at which the time it will take for them to actually heal from this problem might take longer. So that is why sometimes farmers complain that, oh, I've been treating this is not going, I've been treating this is not going. Why is it so difficult to manage this respiratory problem? It's because we're not taking note of those things that we're supposed to do. You see somebody managing respiratory problems, but he keeps changing their litter even though it is not yet time for you to change the litter, and then you keep using a very dusty litter, so they keep having access to this dusty litter, which gives them or makes it worse to actually manage this problem. So most times, if you are managing this problem, try to ensure that you avoid all these things that makes it worse, like I mentioned to you. So it is very critical that you also buy a very good drug. When you are buying your tylosin-based drugs, try to buy drugs from good companies. Try to buy drugs that are of good quality, because it will help you in resolving this problem. Also, uh, when you are managing bacterial diseases in poultry, that brings us to a very important topic. Most farmers, I've had many cases where a farmer will say, I use this drug for a day, I use this drug for 2 days, and then I stopped because I'm not seeing response. I use it only today, but I'm not seeing any changes. So I stopped. Decided to use another one. You have to use antibiotics carefully. It is very, very important that we know that. So, and that is one of the importance of you calling us, reporting some of these challenges, so we can give you the right drug to use. Because sometimes farmers do try and error. Oh, they are having this problem. You just go and buy any antibiotic you like, because there are some certain antibiotics that are drug of choice for certain problems. So if you're having a certain problem, if you buy a drug, if you start using antibiotic, you have to use it for between 3 to 5 days at least. At least don't use a drug for a day and then you stop and you switch to another one, because that could promote antimicrobial resistance. That is which is posing a very serious challenge currently. So we have to be very cautious with the way we use antibiotic. We have to be very, very careful with the way you use antibiotic. You have to use antibiotic with caution. Anytime you start using any antibiotic, use it for at least 5 days before you can reach out to your extension, any of our extension officers, and they will give you advice if you're supposed to actually change it or not. Because sometimes this brings about what we call resistance. What do I mean by resistance? Some of these bacteria that are found inside the system of these chickens, if you use a drug for a day, they might be resistant to that drug, and then you are breeding resistant bacteria. And then if you come in contact with this bacteria as a human being, which means if you come in contact with this problem, if this resistant bacteria come and give you any form of bacterial infection, if you try to use drugs for them, you as a human, you might also be experiencing resistance, which means if you use any of our antibiotics that you use for humans, you might also be experiencing resistance as well. So that is why we need to be cautious with antibiotic. We need to use it with caution. We also need to watch out and look out for withdrawal period. If you buy any antibiotic, you see the withdrawal period written on the sachet of that drug. So when you start using any drug, please be very cautious. Do not sell chickens that you are already using antibiotic on, because the remnant of that drug would still be in the system of those chickens, and then it's not good for consumption at that point in time. So we have to be very cautious when we're treating bacterial infection. We have to use antibiotics with caution. We have to make sure that we use the appropriate drugs at all times. So now we're going to be talking about coccidiosis, which is a parasitic disease. Coccidiosis is a very common problem. Like I mentioned earlier, most times we see this problem happening during the raining season, and the reason is that sometimes you see that farmers forget to drop their tarpaulin, the litter becomes wet, rain enters the pen. Yesterday, one of my farmer called me and said, "Doctor, rain entered my pen," and I said, "Madam, please, you have to be careful next time, because that has certain implications which could affect your birds negatively." So most times during the rainy season, maybe the roof might be leaking. So one of the predisposing factor, one of the things that actually causes problem is when you have wet litter, when your litter is actually wet most of the time. And the reason is because that wet litter makes it easy for the causative organism, which means the parasite that causes this, which we call coccidia, can be able to survive in a warm, wet environment, which means the litter, if it is wet and it is warm, it makes it easy for them to thrive. It makes it easy for them to grow. And before you know, they can be able to move from one stage of their reproduction cycle to another until they get to the infective stage, which we call the oocyst. And then once these birds pick it from the floor and they swallow it, they become infected with this problem. And common symptoms, very common. You see bloody diarrhea. As you can see in this bed here, you see that chickens will start passing bloody diarrhea. You see that there's also reduction in feed intake. There's also reduction in their activity. You also see raw food feathers. You see that their feathers are rough. And those are some of the symptoms that you can be able to see when your chickens are having this problem as well. And this can also be managed. It can be treated with anticoccidial drugs. We have quite a number of them. Amprolium is an example. We have Adacox is also an example. And so many of them that are anticoccidial drugs. Very, very important to note that if you're also managing this problem, if your birds come down with coccidiosis, once you start treatment, ensure that you change your litter because, like I mentioned, the causative organisms organism for this disease is usually thrive inside a wet litter. So if you change the litter, it means you have actually packed out those organisms that maybe their eggs have been laid inside the litter, and then you are also safe from reinfection because even if you treat, and then when you treat, the drug actually kills the parasite that is inside the system. But the ones that are thriving inside the litter has not been killed. So that is one of the reasons why you need to change the litter immediately while you are treating this problem. Preventive measures also is to avoid water, rain entering your pen, either from the side or from the roof. Also, when you are giving them water, most times I do advise farmers, when you mix maybe drug or maybe you want to change water for them after filling the drinkers, the way you turn the drinkers, make sure you turn them outside before you bring them inside the space where your birds are. Because if you want to be turning them inside where the birds are, the part of the water might be pouring on the floor, and then you discover that it results in a wet litter, and that could also uh, uh, make it easy for this problem to actually happen at that point in time. So it is important that you avoid any form of wet litter, or also reduce also inculcate good hygienic practices is also part of the prevention measures as well, to be able to avoid this problem. So thank you so much. Those are the common problems that we're going to be that we've, like I've discussed with you, under the viral problems, the bacterial problems, and also here the parasitic problems, which is coccidiosis. I hope you've had. Okay, thank you very much. I hope you've had a wonderful time. It is very essential to know that mortality, every single bird that dies, when you receive your birds from day old, every single bird that dies is actually a loss to you. And there's also an acceptable mortality rate for every batch. You can be able to actually track this mortality rate. If you're using our app, you can register if you have not registered yet on our app, and there's going to be a presentation after this, like a demonstration on how you can actually register on our app. And guess what? We've actually improved the interface. We've actually improved how the app works. It is easy. It is very beautiful. It makes it easy for you to actually follow track of your poultry farming. If you have not registered yet, you can register with the link in the comment section, and also kindly stay behind so that you can see go through this demonstration that we'll be having to see how you can actually register, because it tells you the mortality rate as you are keeping record of your birds, and you'll be able to know if your mortality rate is actually going out of hand or not. That will also give you an insight of what you are doing, to also give you an insight of keeping track of your production plan at that point in time. Now, let me take questions. Uh, Let me quickly go through the questions. Thank you so much for listening. Thank you so much for your time. Okay, Madam Margaret Suberu, thank you so much from Ungwama Kama, one of our best cluster leaders. She said, I didn't join early. What are the sheet signs of Gumboro outbreak and how can I tackle it? Okay, okay. So what she means is, what are the symptoms you are going to see, especially from the feces for Gumboro outbreak? Like we discussed earlier when we were talking about Gumboro, the best way to prevent Gumboro is through vaccination. So it is important that you vaccinate your pets against Gumboro. Now, the symptoms that you see, especially from the feces, is you're going to see a whitish diarrhea. Especially, you see it pasted on their backside. You see that it is staining, like a stain on their back, you see that their backside, where they are passing their feces from, is always stained with the diarrhea that is whitish, and this is because of the high urate level that is found in their feces at that point in time. So you see watery whitish diarrhea. You can also see it whitish yellowish at some point as well. You would also see that the birds will have ruffled feather. They would also have depression. And like I said, the best way to also differentiate this, to be able to know what you're dealing with or to have an insight of what you're suspecting, is it comes with high mortality. It is an acute problem. It has sudden onset. Between 2 to 3 days, you see that your birds will just start dying. You start seeing whitish diarrhea. You start seeing ruffled feathers. You start seeing lack of loss of appetite. So those are the symptoms that you're actually going to see. And then, like I told you, when you have these problems, you can post them in your WhatsApp group. We're always active. We'll respond to these problems and we'll be able to tell you what to do. Part of the first things you're supposed to actually do is to make sure that you stop the spread. You should reduce activities to other, if you have other batches of birds, because this disease is also highly contagious. It can easily spread to other birds as well. And also you can give a prophylactic antibiotic to reduce infection pressure at that time, so that it can help the immune system to be able to fight this problem. And when you reach out to us, also we'll be able to tell you other practices based on the condition that you are facing at that time, because like I said, this diseases comes in different pattern and methods. Thank you so much for that question. Okay. Evening, doctor. My question is, I don't know if every season comes with different disease, or is it the same? Is it this disease same as always? Okay, so the diseases are the same diseases. The reason why you are seeing them from time to time is because, like we mentioned, these diseases that we picked out are very common. And for the viral diseases, that is one of the reasons why we vaccinate against these diseases, because they are endemic, they are very common. So, but there are some certain diseases that are common at a certain point in time, especially during rainy season. I mentioned that it's like a predisposing factor for what is it called, coccidiosis, because most times farmers don't remember to drop their trampoline. Also, farmers will not know that their roofs are leaking until rain falls, and then that makes their litter wet, and then makes it easy for the causative organism for coccidiosis to actually thrive, and then you see that birds start coming down with this problem during the rainy season. But these diseases keep coming and they keep happening because it is a common problem, and that is why we selected these problems, because they are actually happening almost all the time. Thank you so much, Nafisa Sani Ahmad, for that question. Okay. Ruth Oladimeji said, "Can I still give Gumboro vaccine even when I discover the symptoms of Gumboro outbreak?" No, 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 no. Part of the precautions of vaccination is that you should vaccinate birds that are healthy, not sick. So do not vaccinate birds that are sick. You're supposed to vaccinate birds that are healthy when they are healthy. So when you already have this challenge, you're supposed to look towards managing it first before you can think. So you cannot vaccinate at that point in time, because when you vaccinate your birds, there's supposed to be an immune response at that time. So I'm telling you why you should not vaccinate your birds when they are sick. When you vaccinate your birds, there's supposed to be an immune response, because these vaccines are live vaccines. They are the infection itself that you're introducing at a controllable rate to their system, so that their immune system will respond to it, will be able to produce antibodies against it, and then to be able to actually recognize this problem. So, but then when they are sick, the response that you get from the immune system is not going to be significant, because the immune system at that time is busy trying to fight that problem that is happening at that time. So, and when the response from the immune system is not significant, you're not going to get the required number of antibodies produced to be able to give the required immunity for that problem. So that is why you should not vaccinate your birds when they are sick. So when you have when you have an outbreak of gumboro, what you should be thinking about is how to manage it at that point in time. Thank you so much, Ruth Oladimeji, for that question. Evening, doctor. My question is, I want to know if diseases are same all through this. Okay, okay. I think I've answered this. The second question from Nafisa Sani Ahmad, she said, Second question is, please help us differentiate different kind of disease for each season so that we can be able to identify and take precautions. Okay, so like I mentioned earlier, uh, commonly during rainy season, you have coccidiosis, so you should be able to take precautions. And part of the precautions is you keep proper hygienic practices. You also make sure that you don't have leaky roofs. You don't allow water enter your pen. I also mentioned that when you are turning your water during when you are giving water to your birds, don't turn it inside the space where your birds are, because you might be pouring water on the floor, and that might wet the litter and may predispose the birds to that problem. Also, it is important that you raise your drinkers up, because if you don't, you discover that if your drinker is on the floor, the water tends to pour away easily and it wets the litter also. So for rainy season, that's the common problem that you can face. But for during heat season, we have heat stress, which is a very common problem. But aside that, when birds are stressed generally, like I mentioned, part of the causes of or predisposing factors for disease is stress. And part of the things that brings about stress is, like I said, environmental condition, which is part of it is heat stress. So when birds are undergoing heat stress, it can actually lower their immune status at that time. And that makes it easy for any infection to actually come in and disturb them at that time. It could be bacterial infection, it could be viral problem. So when you are during heat season, you have to be very cautious of that problem, so that you don't actually predispose your birds to other diseases. And many of them, because once the immune system is compromised, it means the system is actually porous. It means the system is actually open for microorganism to come in and settle and cause problem. So during heat season, you have to provide them with a very, very suitable environment so they don't go through this heat stress as much as expected. And then, we always advise that during heat season, you also give them multivitamin, and that will help them in maintaining electrolyte balance and also boost their immune status as well, so that they can be able to stay active and be able to fight any intending infectious agent. Okay. What are the causes of lameness in chickens? Thank you, Julie Uwandu, for that question. So many causes. One, it could be nutritional deficiency. Two, it could also be an infectious agent. Like I mentioned, there are some certain diseases that causes lameness in chickens. One of it is Newcastle. Another one is Gumboro. Another one also is avian influenza. So these diseases can come with lameness. So when you are actually seeing other symptoms coupled with the lameness, you can be able to pinpoint it based on the symptoms you are seeing. For instance, if you are seeing lameness with greenish feces and the head is turning, you can be able to say, oh, it's Newcastle. When you are seeing lameness with whitish feces and lack of reduced appetite, you can be able to say, oh, I'm suspecting Gumboro. So, and the rate of mortality also matters. If it is nutritional lameness, the mortality rate is actually very, very low. So most times, that is how you can actually differentiate it. So lameness could be due to infectious disease, like I mentioned. Some of them, Marek's disease is also there. Avian influenza, Newcastle, Gumboro, all this can cause lameness. From the nutritional aspect, also, if you are having a nutritional imbalance, especially if the calcium level in the feed is not up to the demand of the body of the chickens, you can start experiencing lameness. But that does not come with high mortality. You see that the birds are actually active, they are eating, they are drinking, but they are actually having that lameness at that point in time. And most times you can tackle that when you give them calcium supplement either in their feed or in their water. And most times also you can prevent that if you discover that your birds are growing very fast. So birds that grow very fast actually have high metabolic demand, which means the demand they have for all these trace elements, example, like I mentioned, calcium, is higher than expected because they are growing faster than their age. So when you have birds that are 2 weeks, and when everybody see, they say, these birds look like they are 3 weeks because they are big. Maybe the expected weight at that point in time is maybe 300 grams, but you're already having 400 or 450 grams. You can be able to start thinking about giving them a precautionary calcium supplement in water or in feed so that you can be able to solve that problem. So like I mentioned, it could be either disease problem. And if it is coming from disease problem, you are supposed to manage that disease. But if it's coming from the nutritional problem, if you're having deficiency or nutritional imbalance in the feed, you are supposed to actually manage through giving calcium supplement either in feed or in water. Thank you so much for that question. Okay, I think I've answered this question. What treatment can you give? Like I mentioned, if it is the infectious one, you are supposed to manage the problem. But if it is the nutritional one, you're supposed to give calcium supplement either in water or in feed. But you can also prevent it if you discover that your birds are actually growing faster than you actually expected or more than the standard. So, okay, doctor, I have about 47 mortality rate. Oh God, of births in less than 2 days, new births. Okay, Abel Hosea, you have about 47 mortality. If you are in any cluster, kindly, if you're in any group, probably the general group, please kindly drop this complaint there, or you can drop it on any of our social media because I will need more information to be able to help you. And I'm very interested in this case, please, so that we can stop this mortality and also avoid future occurrences like this. I'm so sorry for your experience. Please kindly drop it in any of our WhatsApp group or any of our social media platform so we can be able to take it from there, and then I can be able to assist you to see what is causing this mortality because I need more information to be able to assist you in that regard. So sorry about that, Mr. Abel Hosea. Okay, please, what is the early sign of cough in birds? Most times, where is the question again? Okay, most times, respiratory problems, you see that it comes, most times it doesn't start with the cough. You start seeing change in their respiratory pattern. When you listen from the sound, you see that the way they breathe is actually changing, is different. And then you can also start, one of the first early signs you actually see is they start sneezing. There's what we call low rate sneezing. They sneeze in a very low tone. So when you listen and you pay attention to that, you're going to actually take note and know that, oh, there's early signs of respiratory problems. So before they actually start coughing, you can start managing that problem. Okay. Okay, Abel Hosea is also actually, doctor, please, at what stage do I vaccinate? Okay, if you're raising broilers, you're supposed to do your first vaccination after 7 days, which is Gumboro. After 14 days, you give them first dose of Lasota. So after 7 days, you give them first dose of Gumboro. After 7 days, you give them first dose. Sorry, after 14 days, you give them first dose of Lasota. After 21 days, you give them second dose of Gumboro. And then after 28 days, which is at 4 weeks, you give them second dose of Lasota. So that those are the stages you're supposed to vaccinate your pets appropriately. Thank you so much for that question. Zainab Ali, good evening, Dr. Isa. Thank you for teaching. Okay, thank you so much. One of our active and wonderful cluster leader. Thank you so much for that. What is the cause of indigestion in birds and what is the treatment? Thank you so much. Most times, indigestion is caused by one or two reasons. First one is the type of feed you're using. Sometimes, if you're not using the appropriate type of feed based on the structure, you know, we have mash feed, we have pelletized feed, we have crumbles. So sometimes if you're I've had complaints where you see a farmer giving them pelletized big feeds. You know, these big feeds, they will say they will try to grind it and give it to chicks because they don't want to throw the feed away or for certain reasons. If they actually eat that kind of feed that is actually too coarse or too big, or the structure is actually unsuitable for the digestive system, you might experience indigestion. Another cause of indigestion is when you are having a disease problem. For example, diseases that affect the digestive tract, coccidiosis, Newcastle, also enteritis as well, because these diseases actually affect the entire GIT. So when the GIT is actually affected, you will discover that the digestive process is disturbed, and because of that, the feed that they are actually eating will not be able to be digested. It won't be digested in the right way or in the right manner. So you discover that they will be experiencing this indigestion. So what you're supposed to do in that situation is to try to manage this problem to be able to solve it. Also, there's what we call kaolin. It's something that you can also give them in water to be able to soothe their digestive tract, so that any form of injury, because most times when you see blood in their feces, like in the case of coccidiosis, is because there's injury that has been occurring in their digestive tract, and that affect the digestive system. Like I told you, even the absorption of nutrient will also be affected. So you're supposed to actually, if it's coccidiosis, you try to treat the coccidiosis. You can also give the kaolin, like I said. Kaolin is like an agent that you can give them in water to drink. It helps in healing those injuries that they have in their digestive tract. So if it is Newcastle or any like enteritis, you're supposed to actually try to manage the problem, which will also help you in managing the indigestion. So those are some of the causes of indigestion that you feed. Sometimes also another cause is if the feed is a very poor or bad feed, probably the feed is spoiled, that could also result in indigestion as well. So the best way to manage that is also to withdraw the feed that you are giving them at that point in time. So those are the causes of indigestion and how you are supposed to manage it. Okay, thank you very much, Immaculata Grace, for that question. Okay, what is the treatment, Grace Daniel? What is the treatment for whitish diarrhea? Like I mentioned, whitish diarrhea could be uh, um, from Gumboro disease. If it comes with high mortality, you can suspect Gumboro disease. It could also be from salmonellosis, like I told you. And in salmonellosis, in small chicks, we call it pulorum. You see that they are passing out whitish pasty diarrhea that is sticking to their bum. In adult birds, they'll be passing the whitish diarrhea like that. And the treatment is antibiotic. So you can get antibiotics like fluorochol, like gentamicin, like doxycycline, like colistin and the likes. So you're supposed to get antibiotic for treatment of this problem. Thank you so much, Grace Daniel, for that question. Okay, thank you so much, Ruth Oladimeji. Okay, so you can drop other questions in our WhatsApp community. The link is in the comment section. Thank you so much for your time. Please kindly hold on. We'll be having a presentation, a demonstration on how you can sign up on our app, which is very important because when you sign up on our app, like I mentioned, it can help you track your mortality rate. It can help you keep track of the mortality percentage, because there's an acceptable percentage rate to be able to know that, oh, my percentage mortality is actually going beyond normal. So kindly stay behind and go through this demonstration so you can have an insight about our app and how you're supposed to sign up and some of the benefits of signing up on our app. So thank you so much for your time. You can sign up on all our social media platforms. Kindly also subscribe to our YouTube channel. See you again in our next training session, which will be communicated to you on all our platforms. So thank you so much. You can drop some of other questions that you have on our platform as well. There's a link in the comment section for you to join our general WhatsApp group. Thank you so much for your time.
Hello, everyone. Please just let me know if you can hear me clearly. You can just type on the comment section if you can hear me clearly. Okay, thank you very much. Thank you, Mr. Episode. Thank you very much. Good evening, everyone. Thank you very much, Mr. Dr. Issa, for that amazing presentation. I'm sure we all learned something new today. I'm sure, like, he gave us like Harvard standard. I'm sure we actually need to give him like a round of applause first before he leaves. Just do the emoji round of applause just to encourage him and to tell him thank you, because I myself learned something really interesting today. So thank you again, Dr. Isa. So my name is Kilichi, and I'm going to be walking us through our Pulos Africa app. I hope you guys are excited. Everyone who has sent all the questions, all the inquiries, all the issues, I'm here to help you out. I hope you're excited, and I hope you have so many questions for me because I'm ready to answer all the questions. But before I start, I'm just going to give us a brief on the Pulos app, just a quick introduction. I know some of us may know the app. Some of us, I'm assuming some of us are actually new here. Um, so if you are not signed into the app, go now and sign into the app before we start the presentation, so that you will not say that you are lost in the process. So for those of us who are new, Plus Africa, um, we have this amazing application that helps you manage your poultry production, right? High level benefits of this app is it helps you see everything in one place. Now, it helps you see everything in one place. So you don't have to have 1 million notebooks to write everything down to be able to track what is going on in your poultry farm. The app, Plus Africa app, helps you track everything in one place. I think that's really amazing. So you don't have to have so many notebooks. Just fill in, put in your details on the app, and you're good to go. Now, it helps you understand and know your bird's health. Like Dr. Isa has taught us today, how you can monitor. So you monitor the birds, how they work. So he even spoke about depression in birds. I didn't know there was something like that. So this app helps you know your bird's health, because by the time you put in the details, like the information that you're supposed to put in for your birds, you'll be able to track what is going on, right? If you have like Mr. Abel that had the high mortality rate, he was able to tell and to be able to, so with the app you'll be able to know, okay, today I had one mortality, tomorrow five, next tomorrow 10. You'll be able to track all of that from the app because you're putting in your data correctly, right? You can also be able to track your true cost. We have this amazing feature that's called the Plus Africa Calculator that helps you track what your costs can be like. So, for instance, you how much did you buy your bag of 25 kg feed? Um, how much did you buy your chick, your day old chick, right? It will help you calculate how much, what the range should be like for you to sell. That's everything on the app. You can't get that just by googling. You can't get that in your notebook. You can't get that just talking. You can find that on the Plus Africa app, right? And you can effortlessly manage your production batches, like in batches. So for instance, this month you're doing one, you want to do different production batches back to back, right? Before the year runs out. You can comfortably, effortlessly manage those batches through the app. You can have as many badges as you want. So you can, batch A can have 100 birds, batch B can have 500 birds, batch C can have 1,000 birds, as many as possible. You can have so many birds, and you can manage all of this effortlessly. And then we have the cluster um, management, the cluster community part of it, where you have access to your cluster leader and the other members in your cluster. Yes, and your cluster leader can even help you update your data. So he can come to your farm and find out. So just in case there was an issue and you couldn't update and things like that, your cluster leader can actually help you update um, your data for your batch records and things like that. These are some of the features. These are some of the benefits of using the Plus app. And I know that as you keep going, there are more incentives and there are more things that you keep gaining from using the app, right? So now I'm going to present my screen now and show you how to um, register, how to log in, how to manage your badge, and different features we have on the app. If you do not have an account with Pulos Africa, please go to app.pulosafrica.com now and sign up. Then, if you have an account, if you had an existing account on the old app, so the app that was there before, we have something better for you on this new platform. So, we're going to work together so that you can sign up, you can sign in, reset your password, and then follow through. Okay, let's dive into it. Okay, so this is the Pulos Africa app. If you're not there, say wait for me. If you're there, say I'm there. Write on the comment section. I have like 2 minutes to wait for you. 1 minute actually. So if you're on the app, just say I'm there or do a thumbs up. If you want me to wait for you, just say wait for me. I have the patience. I want you to understand how this app works. If you want to do it later on, that's fine. You can come back to this video to watch it. But I want some people to follow up now because I know you'll still go back to the community and ask a lot of questions. So learn what you need to learn now from this video. So who is on the app? I'm not seeing any comments. I'm not seeing anything. Who is on the app, please? Thank you, Ikena. Who again? I'm waiting. Okay, thank you, Nefisa. Thank you very much. Okay, we'll just get up to it. Um, yeah. Okay, so once you log in with app.pulosafrica.com, the first page that pops up would be this page, right? This is what your screen will look like when you're using your phone. Okay, that's why I tried as much as possible to collapse it to look like your phone, right? To look like your phone. Now, once you get here, right, for existing users, you click on this reset password, and then we're going to reset your password. So I had an account. I have an account. So we're going to use my account to reset our password. Okay. And then we'll get a code. The next step is to input that code. The code expires, so you need to input it as fast as possible. So we're going to change our password now. Okay, and then we're just going to reset that. If you have got it to this point, please wave. If you have got it to this point, please wave. Thank you, Linda. All right, great. Now let's sign in with the login details that we had. Okay, no, before we sign in, now you have done your reset password. Okay, let's sign in. Let's sign in with our phone number and password. When we're done signing in, for new users, I will come back to show you how to create an account. Deal? Okay, let's do that. Okay, so I'm just going to log in. And we're here. Very easy, very straightforward, and you can see your dashboard. Here you can see your active badges, your total badges, total weights, dead beds, the plus sales calculator I told you about, recent badges, recent records, and other interesting features. Now, let's not be greedy. Let's go and help the people who do not have an account with Pulos. So we'll just sign out. I'll sign out here. I'll log out, and then I would create an account so that you can understand how that works. Okay. So we're going to use a phone number. Please use a phone number that you have access to so that you can easily get your OTP code. So I'm going to use this phone number here. Okay. And then I'm going to use my um, email address. And register. That was easy, right? Yes, that was very easy, right? Now, the next step as a new user is we need to verify. So, start verification. And then let's check for the code. Yes, we just got the code. Right, great. So, we have the code now, and we have verified our phone number. The next thing you see is this tour. This just guides you on what the app is about, just gives you like a quick brief of what the app is about. So you can just go through to see the different features and different things that you can do on the app. Okay, so next and finish. Now, when you come in as an existing user, when you change your reset your password and then you log in, you're going to see this. It's going to be prompted to update your profile. It's very important. Remember, you're in the old platform. Now you're in the new platform, right? you need to update your profile. You need to add some other information for us to identify who you are, right? So now we're going to add our date of birth, um, date, right? We're going to add our gender, we're going to add our marital status, and we're going to add our address, right? We're Nigerians. So I'm going to my address as Kaduna and Kaduna South, right? And I'm just going to do that. Once you update that, you get the prompt on top that says the notification that says address updated successfully, and then I'm just going to update my profile. Once you do that, you get the prompt again, account updated successfully, and your account has been updated successfully, right? So I've walked you through how you can reset your password as an existing user, how you can create a new account as a new user, and how you can update your profile, right? And verify your phone number. I'll walk you through these 4 steps, right? So now we're going to create a new badge. But before we do that, I want you to see what your dashboard would look like as a new user. Remember, we saw what the dashboard looks like as an existing user, where we saw the total number of beds and badges and things like that. So now this is a new user account. So you can see this button that says new batch. This is a shortcut for you to be able to create your batch, your new batch production, right? I'm going to walk you through that. This is a shortcut where you can update your record for an existing batch. For post to market, this is a shortcut where you can post to market an existing batch that you have created. Okay. Um, Active bird summary, total number of birds. This would be the total number of birds that you have in your batches. So it's a cumulative of all the total number of birds you have. So if you have 10 batches, the total number of birds you have in all the 10 batches would appear here. You see that here. We'll see that when we practice how to create a new batch, right? The total number of batches you have, you see that here. The total weight of your birds, you see that here. You will also see the total number of dead birds you have here. Okay. Now let's move to the pull sales calculator. Remember in the beginning, I had told you that there's this beautiful feature we have that can help you calculate your farm expenses, right? And give you some financial plan, right? It helps you have like an idea of, okay, this is the price I should be selling my chicken, right? This is the price I should be able to sell my chicks. Let me not say my chicks. Oh yeah, my chicken, right? That's when they are matured. Now let's test this out. For instance, your you bought a 25 kg, um the cost of your 25 kg feed is 15,000. I might be wrong, but let's just make this for instance. And then the cost of your day old chick is 10,000, is 1,000, sorry. Let's calculate this so that we can see what the range should be like for us to be able to sell our birds per kg. You can see the result, 2,580 naira per kg. This helps you plan for the future, right? So you have an idea that, okay, by the time I'm done raising my birds and all of that, when I want to sell per kg, this is the range I should be looking at selling. Okay. Now let's go to recent batch. So this is a session where you have your recent badge. So when you create a badge, you see all of that activity here and recent records here. So now we're going to get into creating a new badge, right? I'm going to use this shortcut for one of the badges, and then I would show you how to do that. It's the same thing though. I'll show you how to do that from batch management itself. Before I get there, when you click on this hamburger button, so these three dashes on top by your right hand side, you can see the menus. You see your name, hi Kelechi Maru, hi. And then you can see dashboard, batch management, my cluster, your settings, and then the logout button, right? From batch management, you can create a new batch, right? From my cluster, you can see, so when you've been added to a cluster, you'll be able to see your cluster's name, the leader, the name of the name of your cluster leader, right? And your cluster members and their phone numbers. So you can always reach out to them. And as we go forward, you should be able to do more activities on this cluster, right? And this just helps you keep in track with the people around you in your community, in your cluster. And I think this even helps you identify who these people are. You can always reach out to them with your phone number. You can always reach out to your cluster leader, and your cluster leader has access to update your badge records and all of that with your permission. Okay. All right. So here you have settings. We're on that page at first where we had to update our records and things like that, right? So let's go back to our dashboard and create a new batch, right? It's just click on that and then you come here. What's our new batch going to be now? Who is going to give me a name of our new batch so that we can create that? Please, let's try to be very snappy about it. Who's going to give me a new name? Okay, I'm just going to give myself a name. um Maro 1.0. Thank you admin. Plus batch, let's call it plus b 1.0, right? And then an old date at 1 day old, let's put it as 12. How many birds are we rearing? Let's do 1,000. Our poultry type is broilers. Duration of production, let's put it as 5 weeks. Cost of 1 day old, let's put it as 1,000. Our brand, Olam. Cost of feed, 15,000. Our feed, livestock, and we just create that. You have successfully created a batch. Very beautiful, right? Now you have the details of the batch that you just created. Okay. Now, when you click on this, you would see batch records. You don't have any record because you have not updated your record. You just created a batch. If you click on this, you don't have any activity because you have not done anything. You only created a batch. You have not updated any record. You have not done anything, right? For this offtakes, you have not taken your bed, so you cannot see any detail here. Now let's update a record. You remember our day old chick was um we got it on 12th of June. So that means we can actually update a record for, let's say, like 14, right? Total feed given, we have 1,000. So let's do 10 kg, and let's say we gave 10 liters of water. What's our bird's weight? Enter the number of birds weight. I weighed 5 birds, right? Enter the total weight of birds per kg. So let's say one, assuming, I doubt it can be one though, but then sold birds. Enter the number of sold birds. So these are birds that may be sold or gifted to your friends or families, or that you even ate. You can put that number there, but we're not eating our chicks, so we will leave it there. So birds mortality, we've not experienced any death, so we'll just leave that and we'll update that record. Once you do that, look at how beautiful this app populates basically like everything for you. You have your average weight of birds, you have your FCR, you have your sold birds, you have your mortality, age 1 week, face starter, start date 12th of June, last date updated 14th, total feed intake 10 kg, total water intake 10 liters, total body weight bird 200 kg. That's for the 1000. Closing of batch, he has estimated your closing of batch in, this is July 17th, right? Beautiful. Number of birds 1000, your FCR 0.05. Now let me show you something. Come back to this home page and let's see something. You can see the total number of birds that we just added. You can see that there as 1000. The number of batches we just added is how many? One. The total weight is 200. All this was gotten from the information that we put on the new batch and the information we put when we are updating record, right? And here you can see your recent batch, here you can see your recent records. Now, for as you keep updating your records, you'll be able to get real-time information about what's going on in your farm, right? And I think that's an amazing thing for you to have real-time information on what's going on in your poultry farm. Now, if you want to update your records from here, you click on it, it will ask you to select an existing badge. We remember we just created Pulos B 1.0, so we're going to click on that to update our record. We started our batch 12th of June. We have updated our record for 14th of June. Now we're going to update our record for 16th of June. That's here, right? I would say amount of feed given, let's say 11 kg, because the birds would have, their stomach would have expanded a bit more. Dr. Isa will correct me on that. Amount of water given 11 liters, birds weighed 5. The last time I think we did 10 kg, so we'll just put like we did one, so we'll just put maybe 2 kg here. And then sold birds is not yet ready for us to start selling and eating, so we'll leave that. Bird mortality, let's say we had 2 mortality, and let's update our records so I can show you what that will look like. Can you see? So this automatically shows you your dead mortality. So you have 2 dead birds. Your total weight is this, because remember we have updated our badges twice. Your total bed, this is total bed that you updated when you were on, like when you were imputing your badge on the app, where you can see that you have the mortality down there, right? Now if I take you back to badge, which is this, you can view the details, right? You can now see here number of birds. You now have 998 birds left because you had 2 mortalities. So this calculates everything accurately for you. Okay. Now, if you go on batch records, you can see all the records, all the things that you have been imputing, all the activities, all the records that you have imputed on the app, right? If it comes to activities, you can see the things that you have done on the app. You can see all the records that you updated. We don't have any updates because the birds are not ready. But I'll just give you like a snippet of what it looks like. So if you want to post to market, all you need to do is come to your, let's just try that again. Come to, either you click on this badge or you come to these 3 buttons up by your right hand side. Click on batch management and you see view all your badges. Now on this page you can see all the number of badges. If you have 1000 badges, you're going to see all of them, both the active and inactive and all of that, right? Now you can click on this button to update like we just did from the dashboard, and you can click here to view details of the app. Now, once you click on that, um, you just scroll down here to post to market, and then you can now put in the details, the date of sale, the weight per kg. You can't actually put anything here because this populates from the data that you have been filling in into the system, that you have been populating into the system. That's what calculates your weight per bird. So if you put in the wrong data, when we come to verify your offtake, or um, Nafisa has posted to market, and we go to Nafisa's farm to verify her birds, and we notice that the weight per kg that we are seeing is different from Nafisa's weight on the farm. It's not going to look good, right? So that's why it's nice for you to always update the true figures, so that we can always come to you to take your birds and buy your birds from you, and you can make a lot of money. Okay. Now you can now put number of birds and then your description here, and click on post to market. Very easy, very easy, right? Just in case you mistakenly try to want to close your batch, you can click on this and it will surely prompt you. You can either cancel or you actually delete your batch, but there's really no need to do that unless maybe you made a serious mistake, right? And then that's that. Now I'm going to talk about my cluster just a little bit. Like I said earlier, we don't have any data here because we do not have a cluster leader. We do not have we do not our cluster leader has not accepted us, or we have not we do not have a cluster yet on this app, right? But for a cluster leader, let me try to log into a cluster leader app. Let me log out from here. Um, So, for cluster leaders, right, this is what your app would typically look like, right? And you have the details of your farmers and the rest, and you have your details and things like that. And you have the opportunity to be able to view details of your farmers like this, and you can be able to view their badge and things like that, right? So, for this to happen, admin would add you, would assign you as a cluster leader, and then you'll be able to request farmers in your clusters. So it's important that your farmers, the farmers in your cluster, actually sign in, or um, sign into the app, or sign up to the app, so that you can be able to add them to your um, cluster on the app. It's important that you do this because it's beneficial to both you, the cluster leaders, and the farmers, because you have access, and there will be other things that will be unfolding, and so that you don't miss out on things like that. Okay. So I've come to the end of my demonstration. Before I end, let's go back to settings so I can show you something that's really nice. Now we you can change your you can update your password whenever you want to. You can add multiple addresses. So now we have this address. You can add as many addresses as you want, and all you just need to do is to assign it to whether home, farm, or office. And you can assign whichever of the addresses you have as your default address. So default address means when you request for offtake, your default address is the address that will come to. So if you have a farm in Kaduna, and you live in Abuja, and your office is in Lagos, your default should be your farm, because that's where we are going to come to. Because if you go to Abuja, then exactly. So um I think I've come to the end of my presentation. I'm just going to look through and see the questions that have been asked, so that I can respond to them as quick as possible. Thank you very much. I think okay. I think where do I start from? Okay. Mr. Usman has said that no, no, no. Okay. Mr. Usman has asked, I'm on okay, he said I'm on the app. Okay, thank you very much, Mr. Usman. Nafisa said, please, does it mean we're logging in as existing users, but we have to reset and fill the code? Yes, you are logging in as existing user. So when you get on the app, you will see that prompt that says heads up. All you need to do is to click on that reset button and reset your password with the phone number that you registered on before. So what you were using on the other app, on the other version, because it's the same app, on the other version, just reset, use that same phone number and reset your password. That's all you need to do. You don't need to create a new app, a new account. All you need to do is just reset um, your password. That's all, and then log into your account so that you can continue your with your management and things like that. Okay, I hope I was able to answer that question properly. In Kiruka, is there a link for the app or can I download it from Play Store? There's a link. That's what's on the screen now. App.pulusafrica.com. App.pulusafrica.com. Usman said something again. I'm at the I'm at this point, but please telling me the phone number and password combination is wrong. Yes, you need to reset your password first. You need to reset your password first. And please make sure that the phone number that you're using is the phone number that you registered with. Don't use another phone number. You have to use the phone number you registered with. That's the one we have on the system, right? So use that. Just update your password, reset your password. That's all that is needed. Yeah, thank you very much, admin. Usman Swabira. Okay, okay, thank you. Mr. Paul said, I tried typing the age of my birds in days, but couldn't. Your app shows age in weeks and not days. Can you put me through? Hmm. Okay, so you can't type the age of your birds in days. You can type them in weeks. I need to understand that question better though. But let me see if I can go back to the app and click on so date as 1 day old. So you all you need to do is to pick the date, right? The app will automatically populate the weeks and the days for you. Do you understand? If I'm not answering your question properly, please just go on the WhatsApp chat and I can reach out to you personally. Um, please. Okay, Ruth Olajimeji, please, I do not have the app on my iPhone. What should I do to get the app? Please go to the link app.pulusafrica.com, please. Thank you. Nafisa, can I update the batches that have already of taken? Hmm. Do you have birds? Like, did you off take some part of it and then you still had some birds? Those are questions that I will need to ask. But if you have off taken all the birds, why are you updating the batch? What exactly do you want to add in the update? That's a question I need to ask you too. But you can go on the community and you can ask a question and I can reach out to you personally also. Nafisa said, please follow team, try to organize a training for cluster leaders that will discuss only this online update because Gaskia. I'm not understanding procedures. Great, we will do that. We will look into that. Thank you, Nafisa, for that. Thank you. Um, all right. Good evening, doctor. How do we okay, please blessing. I'm not a doctor. I'm just a little tech girl. Um, so please just put in your information on the WhatsApp chat and the doctor will get right to you. All right. Thank you so much, everyone. Thank you for your time. Thank you for staying up, staying till this time just to make sure you get this information properly. We appreciate. We appreciate. Thank you so much. Thank you. Thank you very much. So I'm just going to disconnect now and hand over to our admin. Thank you so much, admin. I appreciate. Thank you, everyone, for joining. I think we can call it a night. All right. Good night, everyone. Thank you. Please don't forget to drop your messages and your questions in the WhatsApp chat. We are happy to help you out as much as possible. Thank you so much again. Have a lovely night's rest.